Safety and economic concerns during this pandemic led to a substantial decline in patients actually visiting their doctors. But there's still ways to go about going to see your doctor in a safe manner. Dr. William Schrank, Chief Medical and Corporate Affairs Officer for Humana, is joining me with tips on how to accomplish just that. Dr. Schrank, thanks for joining me.
Thanks for having me.
Let's talk about this latest trend, which is not too good of a trend. How many people are talking about when we're saying people are not going to see their doctors?
Dr. Ian, we're talking about a lot of people. About 40% of all Americans either delayed or avoided routine medical care in the setting of the pandemic. It's not entirely surprising because folks are concerned about being exposed to the virus if they go in person. However, social distancing must not mean medical distancing. It's really critical that we keep our members, our patients, continually seeing their healthcare professionals.
We had viewers who reached out with questions on this topic, so I want to take a look at the first one.
My name is Ralph, and I'm 75 years old, and I want to know if at my age, a routine checkup or a preventive doctor's visit is worth the risk of being exposed to the COVID-19 virus.
Contracting the COVID-19 virus can be very serious, of course, and you should always take into account any underlying medical conditions that you might have. But delaying care, even when it's routine or it's preventative, well, that too can also lead to some serious health complications. Dr. Schrank, people should be aware of this, right?
Absolutely, Dr. Ian. Skipping routine screening tests may mean a lack of a diagnosis of something that could potentially be life-threatening. And it's just so critical during the pandemic to continually maintain that proactive approach to managing your health.
And Ralph, here are some tips for when you arrive at your medical appointment. First of all, wear a mask, always wear a mask, not just over your mouth, but also over your nose. Make sure you're washing your hands for at least 20 seconds with warm water and soap after touching any surfaces, and avoid touching your eyes, nose, and mouth. Those are areas that are typically where the virus can enter. Now, before you arrive, you can simply ask the doctor's office about their sanitizing measures and what they're following as far as social distancing. Lastly, ask if they actually offer touchless payment. Dr. Schrank, anything you'd like to add to that?
I would. So Ralph, every state has safety guidelines in place for healthcare facilities to make sure that when it's time for you to go back and see your physician, that you feel safe and confident to do so.
Absolutely. All right, Dr. Schrank, we have another question. Let's take a look.
My name is Judy, and I'm in my early 60s. I don't want to keep putting off my medical appointments, so I'd like to know, how can I do this safely during the pandemic?
Now, Judy, you may want to consider asking your doctor if you can do something called a telehealth video consult instead of having to go in person. This service is offered around the country, and sometimes it can avoid the nervousness and the fear of going in person. Dr. Schrank, your thoughts on that?
I totally agree. There's a lot of options for patients in terms of how they can communicate with their physicians. One option is just calling them on the telephone. So I'd encourage patients who have concerns about going to the office to talk to their doctor and figure out what the options are.
We have time for one more question. Let's take a look.
My name is Victoria, and I'm a caregiver to my elderly parents. My mom has pulmonary issues, and my dad has cancer. I'd like to know some safe options for maintaining their healthcare needs other than constantly taking them to the doctor's office.
Now, Victoria can ask their insurance provider about in-home care options for her parents. Dr. Schrank, what actually do you suggest?
Well, many insurers offer mail order pharmacy, drive-through pharmacy, and curbside pharmacy just to make it easier to pick up one's prescription drugs. In addition, you can ask for larger supplies of your medical products that last longer and reduce the frequency that you have to go purchase those products and reduce your exposures.
Before we go, I also like to mention that loneliness can also greatly impact our health. So it's important. Reach out to a loved one or a friend. Let them know that you're there. Let them know that you love them and that you're still able to communicate even if you can't see them in person. Dr. Schrank, any final thoughts?
During the pandemic, many have found it hard to get out of the house and go to the grocery store to buy food. And some, sadly, are having more difficulty financially being able to afford nutritious food. I just encourage everybody who's struggling with that to ask their doctor or ask their insurance company. They may be able to provide for them a community-based resource that can help.
Absolutely. Well, Dr. Strang, we covered a lot of ground today, and I thank you so much for joining me with all this important information and advice. Thank you.
Thanks for having me.